Generally speaking, if someone has elective or semi-urgent valve issue that needs surgery, let's say an aortic valve replacement, the surgery would be approximately 3 to 4 hours. You'll spend one night in the ICU, and your overall hospitalization will be about 5 days. You would be expected to go home after that for recovery. The full recovery from healing of the bone of the sternum takes about 3 months. But at about 6 weeks, when we see our patients, they're about 80% healed. That's generally what patients can expect for quite straightforward open heart surgery for a valve replacement.
So typically the patient is referred for surgery. The next step is they're reviewed by the surgical team and either accepted or we ask for further testing. Once accepted to the program, they come in and meet with the surgeon. They get all their questions answered. They go over all the details of the procedure. Next, they'll hear about a surgical date. Once that happens, the next step is they will go to pre-admission and meet with some more members of our team, including anesthesia, which will screen them and make sure they're in the healthiest state for an operation. After that, they will then get a surgical date. On the day of surgery, you check in at the surgical waiting area. You'll meet with a nursing team that will do a nursing assessment, put an IV in. You'll be in a gown getting ready for surgery. You'll then meet with more members of the team, including the cardiac surgery team, as well as anesthesia again, ensuring you're in the best condition to go to surgery. From there, you will be brought to the operating room. Your family will be told where to wait for you. After the operation, you'll be brought to the CVICU, which you will stay overnight. And the next day, the plan is to transition you up to the cardiac surgery ward. From there, your recovery will start, and you will then be up walking the next day, moving around the unit, eating again, with a plan to send you home on the 5th surgical day. When leaving the hospital, you will be given some instructions as well as some education related to your recovery. You may have some dietary restrictions as well as some necessary exercises to be done at home.
I would also say, just in preparation for the procedure, keep yourself as active and healthy as possible. It's only going to benefit you in your recovery afterwards. So get out for a short walk if you can, each day. I would just say that that's probably one of the most important things, is to keep moving.